Hey everybody, it's Dr. Josh Levitt here. I am at my office and today I want to talk to you about a treatment that's not used anywhere near often enough. This is an old school naturopathic mainstay and it's called contrast hydrotherapy. What contrast hydrotherapy is about the therapeutic use of water, and in this case hot water and also cold water and even ice. Most people are familiar with the therapeutic properties of both. Anybody who's ever soaked in a hot tub knows the comfort that can come and the muscle relaxation that can come from soaking a body part or your whole body in hot water. And most people who have had any orthopedic injuries or bumps and bruises are familiar with the anti-inflammatory and therapeutic properties of ice or cold water immersion therapy. But rarely do people do both, right? So in many connective tissue structures, most especially tendons, ligaments, and structures within and around joints, the blood supply to these regions is very minimal. So a tendon or a ligament, for example, is rather white when a surgeon kind of cuts into it. And that's because it has very limited, or in some cases, no blood supply at all. And we need blood to help heal our injuries or help decrease our inflammation. Of course, inside the blood is where all of the good nutrients from the foods that you eat, or all of the good medicines or phytochemicals from herbal medicines that you might take, like things like turmeric or boswellia. Those two are the active ingredients in one of my favorite formulas, AI4X by Up Wellness. But also all of the good stuff that heals injuries, heals wounds is carried around in your blood. So if you can figure out a way to enhance blood flow to these areas that are otherwise limited in terms of their natural blood supply, that can be very helpful. So here's how contrast hydrotherapy works. It's quite simple, and it's just basically alternating hot and cold immersion or hot and cold applications to the body part. The way I like to recommend it is a cycle of heat, usually lasting anywhere between 2 to 4 minutes of heat exposure. That can be immersion into a bucket or a tub, or direct exposure with a hot towel or a heating pad. Usually moist heat works best for, let's say, 2 to 4 minutes, and then rapidly switch over to a shorter term cold exposure. So let's say we put the body part, let's say the hand, into a hot bucket of water for 2 minutes, then we're going to take it out after 2 minutes and plunge it into a bucket of ice water for just about 30 seconds, a fraction of the time of the heat exposure. Leave it in there for 30 seconds, kick and scream and yell because it's really cold, and then take it out and put it back in the hot exposure for another 2 minutes. And we're going to repeat that cycle. Hot, then cold, then hot, then cold, then hot, then cold. 3 cycles of heat and then cold, and then take it out, ending on cold. And there you have it, contrast hydrotherapy, a remarkable tool for the heat to bring the blood flow to the area, the cold then to flush it through, and then the heat to bring blood flow to the area again, cold to flush it through, creating this kind of pump effect, bringing more blood flow to the area to help you heal your wounds faster. So I hope that helps you, and take good care.